Good morning.
Good morning. Hi. My name is Agatha. I'm a recruiter for Women's and Children's Hospital. I see that you applied for our RN grad fellowship at high-risk perinatal unit. And can you tell me if you have any experience that would be beneficial for this position and unit?
Yes, so in June of last year, I accepted an externship position on the high-risk perinatal unit, which basically I was following one of their skilled nurses on the unit who acted as my preceptor from June until August. Before I started, I went through a 2-week training that kind of solidified the skills that we learned in nursing school and more of how INOVA's policies apply when doing those certain skills like IVs and Foleys and stuff like that. So it was, like I said, until August, and I learned so much through Monique, who was my preceptor. And at the end of it, the hospital was on a hiring freeze, so I was able to start back on the unit because they asked me to stay on as a clinical technician. So I stayed on, and I started back in November, and I'm currently working there now. So I do have plenty of experience on this particular unit.
Okay, great. Well, it sounds like you do have a great skill set, and it's great that you want to continue on this unit. So, tell me one thing that you're most proud of.
So I think my proudest time or moment or accomplishment is going to be that in May I finished nursing school. It's something that I've dreamed of, and I didn't know that it would ever be possible. I had my son when I was 18, which then, everybody says you won't be able to go to school. But after I had him, I knew that I needed to do something, and he helped motivate me to go and pursue my career in nursing. So I started doing my prerequisites at Northern Virginia Community College, and I got my associate's degree in general studies. And after that, I applied to Shenandoah and got in. So since then, I've been working hard to achieve the grades that I've wanted, and now I'm almost done. I graduate in May, so that has to be one of my proudest times.
Oh, great. That's great. Definitely nursing school is a very proud moment, and it's a huge achievement, so good for you. But speaking of grades, do you think that your grades are a good measure of your abilities as a nurse?
I think they are, because it has taken a lot of hard work and dedication to get the grades that I have. I've had to prioritize school over everything, essentially, over my family, over, spending time with my son. But because I've gotten the grades that I have, it's made it all worth it. And I think that, my personality really shows through that, because I'm a very dedicated and hardworking person. And I prioritize things, in a way that makes it so I get the outcomes that I want. And so far in nursing school, that's exactly what's happened. So I do believe that they are a good indicator of my abilities.
Yes, absolutely. Now, tell me about most memorable patient that you had maybe throughout your clinical experience or when you were working as a clinical technician on HRP.
Yes, so one of the first few patients I had when I was an extern on HRP was a patient that was incarcerated, and she was pregnant with twins. And she came in, she was very sick, and we found that she was going into DIC. She had very low platelets, and the nurses and physicians were all in her room, kind of talking around her. They were talking about delivery, they were talking about, everything that needed to be done, but nobody was speaking to the patient, and nobody was speaking to the patient on a level that she could even understand. So it was all medical terminology that was being thrown around. She was confused, she was scared, and they were treating her like she didn't have human rights. Even though she was incarcerated, it didn't make a difference to them. They treated her very poorly. So when we left the room, briefly, I spoke with the nurse about maybe trying to encourage more communication towards the patient, because she was very upset, very worried. So when we went back in, I had to draw her blood, and I was trying to explain a little bit of what the doctors had said about her to her to help bridge that communication gap. And after that, the nurse had talked to the physician about coming back in and explaining to the patient herself what was going on, why it needed to happen, because up until then she was refusing to be delivered because she didn't know what was going on, and she was angry that nobody was talking with her. So right before we took her down to the OR, she like grabbed my arm and told me, and thanked me essentially for bridging that communication gap so that she knew and understood how serious her situation was and that the babies needed to be delivered, and just thanked me for advocating for her. So I was very happy at that time that it was one of my first patients and I was able to be that impact for her.
Yes, great for showing compassion, because obviously this is one of the most important things in nursing practice. And lastly, can you tell me what would you do if you noticed a nurse giving a medication late every single time?
Okay, so the first thing I would do is try to solve the problem or figure out the reasoning behind the problem, like on the first level. So I would speak to the nurse herself directly and I would ask her, like, I've noticed that your medications seem to be administered late. Is there any reason why? One, to try to figure out why they're being late, and then offer my assistance and see if there's anything that I can do, either help her prioritize in the morning or figure out a way that I can help her give those medications on time. If she is still unable to, then I would bring it up the ladder, go to the nurse manager, talk to her, let her know what's going on, and see what we can come to together. But I would first try to solve it one-on-one with her before involving management.
Great. Well, do you have any questions for me?
Yeah, so can you tell me what the nurse-to-patient ratio is on this unit?
Usually we have 3 to 4 patients per nurse, and usually we get pretty busy, so that's what you would get most of the time during your shift.
Okay, and how long is the fellowship program?
The fellowship program lasts 14 weeks. It's half of this, the first part, 7 weeks, is in a classroom, and then the second half is on the floor. So you would be working with a preceptor on the actual unit.
Okay. All right, and lastly, what is the next step in the interview process from here?
So the next step would be me contacting you with either an offer letter or letting you know that you were not chosen. And we're still going through interviews this week and next week, but you should hear back from me within the next 3 to 4 weeks.
Okay. Well, thank you so much for taking the time to interview me, and I really look forward to hearing from you.
Thank you so much. Have a good day.